afternoon and good evening, depending on where you are. Thank you for joining us in the fourth series of CHReaD webinars. The theme for this webinar is prioritization of health research, development and innovation in COVID response in Kenya. And the webinar is organized by Coalition for Health Research Development, CHReaD, in partnership with PATH and AMREF Health Africa. And for today's specific conversation, we are looking at promoting investment in COVID-19 research, development, and investment in Africa. And we have managed to get excellent panelists to introduce the subject matter, and I'll be introducing them in a moment. But let me also introduce myself. My name is Dr. Langat. I'm the program director in charge of HIV, TB, and malaria at AMREF and NCDs, and I'll be your moderator for the day. And just to go through the logistics, a few of them, we want to hear from you during this conversation. So we encourage you to use the chat box at any time during the discussion. Just share your thoughts and your comments and your questions. We will be monitoring the chat box, and we'll be in a position to consolidate and escalate the questions to the panelists. But you can also join us in online conversation by tagging us at PATH tweets, at CHReaD Kenya, at AMREF Kenya. This call will be recorded, and so as we can also distribute to those who are unable to attend. And so we'll have the videos up for the speakers. Of course, we know the challenges of the internet connectivity, but we should be able to see how to surmount that. And briefly, let me just introduce the PATH and CHReaD and AMREF Health Africa. And CHReaD is a coalition, in full it means Coalition for Health Research and Development. And basically it's a network of 26 civil society organizations that was formed in 2015. At the moment it is hosted by PATH, but we'll be transitioning to AMREF actually from 2021. The transition process has started. And the mandate basically is advocacy for enabling policy environment, increase and sustain investment in health research and development, and of course, strengthening of the regulatory systems for medicine and other health technologies that is expected to improve the health for Kenyans. And PATH is a global organization with very strong presence in Africa, dedicated to achieving health equality so all people and communities can thrive. Through partnership, PATH drives public health solutions that meet most of the pressing needs for families, communities, and countries. And PATH specialties really ranges across the health system, diagnostic, drugs, devices, research and development, and policy and advocacy. And briefly about AMREF is an African organization that is headquartered in Nairobi. We are running, AMREF currently runs a number of programs in 35 countries in Africa, including Kenya. And we are able to reach the 47 counties in Kenya. AMREF's vision is lasting health change in Africa, and with its mission really to increase sustainable health access to communities in Africa through solutions in health resources for health service delivery, and investment in health. And for today's topic, we are looking at local innovations, trying to leverage on local capacities to address the local health challenges. And to discuss this topic, a very important topic is a panel of two speakers. We want to apologize. I think when we communicated, we ought to have three speakers. Dr. Jemima Bonsare has just gotten an urgent engagement, and she is unable to join us. So we'll be having in today's conversation strong representation from NACOSTI, Dr. Mary Onsariko, Senior Analyst, Biological and Health Services at NACOSTI. And we'll also be having Ethel Makila, Associate Director for Advocacy, Policy, and Communication at EAFI. So briefly, let me just go briefly on the bios for our eminent panelists. And of course, Mary Onsariko is working with NACOSTI. She is a PhD holder in biotechnology from Queensland University of Technology in Australia, and holds 2 master's degree in biotechnology and information technology for informatics from Kenyatta University, University of Manchester in UK. And she holds a bachelor's degree in education science from Moi University, Kenya. She comes to us with over 23 years of work experience within different government departments, with 10 years in NACOSTI. Mary is a council member of the National Council of Occupational Safety and Health, representing NACOSTI. She's the vice chair of the Kenya Australian Alumni Association, chair of Women Leadership Network in Kenya, the Kenya chapter, under the Alumni Associations in Africa. She is currently a member of the Secretariat of National Multi-Agency Team for Chemical, Biological, Radiological, and Nuclear Materials. She previously worked in collaboration with the Defense Threat Reduction Agency, supported by USA, and Center for Biosecurity and Biopreparedness in Denmark, in implementing different projects with different governments. Mary has worked closely with and consulted with several international institutions, including International Food Policy Research Institute, Managed Program for Biosafety Systems under Africa Agricultural Technology Foundation, and International Services for Acquisition of Agri-Biotech Applications, and the National Commission for Knowledge and Use of Biodiversity, Mexico. So you can see that we have quite a very strong panelists to unpack for us the investment in research, development, and innovation. The second panelist is Ethel Makila. She is the Associate Director, Advocacy Policy Communication at IAFI. Ethel is she's responsible for designing, implementing innovative political policy and science advocacy initiative aimed at enhancing environment for global health research and development, leading communication initiatives related to IAPI's African regional programs. She's a seasoned science and development communication expert. She has over 10 years experience in stakeholder engagement for both profit and non-profit agencies, development, agricultural research, and global health field. She holds a Bachelor's of Art degree from the University of Nairobi, and she is currently completing a Master of Science in Agricultural Information Communication Management from the same institution, University of Nairobi. And she's also pursuing a Master of Public Policy and Management at the Strathmore University in Kenya. So these are 2 prominent panelists who is going to unpack for us specific areas concerning today's topic. And I want to invite the panelists, and I'll start with Dr. Mary Onsariko, Senior Analyst. Please, the key question we have set up for you is, we know that Kenya, alongside other African Union members, have committed to health research, development, and innovation. So we just want to get from your perspective, what is the status of research, development, and innovation investment in Kenya? Probably you can also give a global African perspective. And we are looking at both the public and the private sector. And as you tackle that question, I'll ask you to maybe just make a brief introduction. I know I've already done it for you, but just from the horse's mouth. The floor is yours, Dr. Mary Onsariko.
Thank you, Dr. Langat, for the excellent introduction. As members have heard, my name is Mary Onsariko, and I work for NACOSTI. The National Commission for Science and Technology, as you know, its mandate is to clear research proposals to actually regulate any research that is taking place within the borders of Kenya. And it's also, its mandate is to promote science and also set priorities in science, technology, and innovation, and many others that I may not even mention all.
Mary, please, are you having challenges with technology, or is me is I can't hear you?
It looks like I was disconnected momentarily.
Mary, if you have challenges, you can also remove the video mode so that you just go on audio. I think that should be also be
yeah,
okay.
I think the internet is not strong enough to support the video. Maybe if you allow me, I can remove the video.
That is okay, Mary. It's okay.
Yeah, so I was just introducing the topic and just taking recognizance of what is happening with the COVID-19 crisis. And now, more than ever, innovations primarily that are aiming in treatment and getting vaccine is what is the humanity require currently so that we can overcome the economic lockdown. So coming to the matter, the subject matter, the R&D in Africa. For any action you do, you must expect an output. So you can see the African research output is just 2%. And compared with the population, which is 15%, their investment is as low as 1.1, and this is data I got in that was retrieved in 2016. So, and the fact is that Africa is burdened by disease. About 25% of the disease burden is within Africa. However, a few countries in Africa, such as Egypt, Nigeria, and South Africa, they have tried to spend a little bit more than the rest, such that the three countries accumulate up to 65.7% of the total R&D spending. So this is actually quite high. Looking at the rest of the countries, it would be a very small proportion. What it tells us is that, or from what there is on the ground, is that organizations for economic cooperation and development are the largest source of funding. And in that sector, the private sectors are able to do the funding. Please scroll down. While in Africa, we depend on the public for funding. So you can see in where we have, and these economic cooperation developments are largely in the Western. So there, private sector has been looked in the funding of R&D. The challenges we have is to get, just scroll down, to get a stable funding mechanism. And we know finances are required because if we are talking of innovation, we are talking of research. What we are looking at, it is products, it is services, and they are goods. So this requires finances from even coming up with the idea, commercialization, expanding of that business, and eventually having a sustainable business or service depending on what you are doing. However, the public support schemes remain essential vehicles of innovation, and yet in Africa, that is really limited. I tried to find out why do we have less funding in Africa through the public sector. From the literature, we find that there is very little that translates. The research that is being carried on does not translate to products or even policy. So mostly, and I'm going to give that figure from NACOS because we do a lot of research clearances, that it is more for academic. It is never translated, and even if it is research that has a product, there is a problem in moving that process from a prototype to a product or even to commercialization. So you get there is a lot of inability in translating the research into action or even product or policy. And maybe this is because there is a lacking, the home countries do not fund most of these researches. And therefore, if it is the donor who has funded, they have their own objectives to the funding. This is a quotation I can quote Dr. Rogo. He had a meeting and there were out of the 300 top researchers, only one was able to confess that his research was translated to action, which was policy. So that justifies that most of our researchers and most of our researchers and their research do not translate to the action or any meaningful product that maybe the government may require. Because here we are now focusing on health, the medical R&D is heavily funded by donors. And what we learn from the funding is that it does not align 100% to Africa's agenda or the needs. So we may truly say that he who pays the piper calls the tune. So what it means, they are funding aiming that the results they are going to get will be answering to their own questions from, their source. Nigeria, Ghana, and Kenya, the narrow funding base suggests that research and innovation system, they face a lot of deficits and lack capacity to formulate and drive their own domestic research agenda. And looking at who funds in this medical area of the health research, health R&D, we have still the donors, and their focus is on, they have prioritized diseases. And a list of those are the parasitic vector and vector diseases. We have HIV, tuberculosis, leprosy, and skin disease in Africa. The point here I'm trying to pass is that these priorities may not necessarily be what the African countries need, but it looks like the donors have prioritized. So what we do, we depend on their money, and the researchers will always accept that fund and continue with the research. And that is why it may not be able, at the end of the research, it will not be able to translate what the government requires. So in 2015, the scientific output around in medical research on 28 diseases by African researchers counted for only 2.1%. And what we have gathered from the literature and then data that is available, that it is the pharmaceutical industry, it's really funded here in Africa. And this could be because of the heavy investment and the returns that are expected out of it. So generally, funding in Africa, we can say that it is below always the targets that are set either regionally or globally. We can see in Kenya, the percentage of funding is actually 0.45. 0.45% of the continent's GDP, which is on average at 1.70. What does this mean? Still, we go back to non-alignment of what we require and what is required by these the movers of the economy. So in most cases, they don't meet the competing needs. And scientists, as they are, they will always focus on their area of specialization. It does not matter whether that area is whether it will answer the questions that the government will need to be answered, but as long as they are pursuing research within the area of specialization, they go ahead, and that is where the non-alignment comes in. Looking from this data on the global innovation index, it shows that the output performance across Africa, I've highlighted Kenya there. This shows the countries, what they are funded here. Like in Kenya, health research does not even appear. What is outperforming here is ICT and organizational model creation. So you can see the mismatch. So ICT, it looks like being an enabler a sector, and it has a lot of innovations and there is much of the funding. That is where those who are carrying out the research move to. So there is always that mismatch depending on who is funding. Just coming home, examples in South Africa, because it seems to be one of those leading countries within the African continent. In their Ministry of Health, they have allocated a 2% of the national budget to research, and their health policy, they also committed a 2% of the total public health expenditure. But what is on the ground, it's not that 2%. They can only, they are only able to have a 1.7% spent on health research, which translates to 0.033% of the GDP. So, and this is the story across most of the Africans. They have policies which actually commit and set goals, but the actual funding does not always meet. And maybe this is because we have other more pressing needs that require the funding. Uganda is the same. It has 9.6 of the total expenditure. That is below the Abuja declaration or Abuja commitment, where most of the Africans committed to 15% fund of GDP to health research. So coming back home, we are also party to the global average. We have committed the country has committed to the country has committed to the 15% that was declared in Abuja. They have also committed to allocate 1% during the African Union pledge. And also in Vision 2030, they have talked a lot on mobilizing resources for health research. And even in the Science Act 2013, the government allocated a 2% of the GDP to R&D. And this is the fund that is controlled by National Research Fund. Surely, as we are going to see the figures, we are
Dr. Onsariko, I don't know whether you still have issues with your internet. You seem to have lost your presentation.
And even the public health.
Dr. Onsariko, let me know if you can hear me, because we are not hearing you.
It's raining. I think it's interfering with the network. Maybe that's why I'm on and off. So I'm almost finishing. Coming to Nakosi, where we do research clearance, we look at the budget of all those proposals. So between 2017 and 2019, those proposals had a budget of 2.8 billion. So in average, we can talk of 0.9 billion annually. And going into what NRF allocates. So before NRF was established, this fund was being managed by NACOSTI, which was known as National Council for Science and Technology. So, and it started in 2008. So the first batch of the money was 250 million. And you can see what percentage of the GDP that we had. So this, it increased progressively, not immensely, but at least it increased to 497 million. That was 2014, 2015. But still, it was not reaching the 2% or even the 1% that they were pledging at the African Union. Then when an NRF was established, this function was handed over to NRF. And at the beginning of NRF, at the inception of NRF, they were given 20 million. It was very little money. And that increased progressively to 1.8 billion. That was the year 2018 and 2019. That is the highest it has ever reached. And this year you can see it has dropped down to less than $1 billion. And this money, it is for total R&D, whereby all sectors are supposed to access. So you can imagine what the portion is, what health research will get out of that portion. So we can conclude that even Kenya, it has not reached the 2% commitment. And what is common that in the African countries, the private sector is very shy in supporting most of the research, and maybe because they do not translate to products, or even those products that come out of the research have a heavy financial implications. So just having an example from CHReaD, the year 2019-2020, that is the amount that they were allocated for research. Still, it's a very, very small portion because CHReaD, it is the reference laboratory in Kenya to do research in human health. Even the economic stimulus that was announced this year, May 2020, they talked of 1.7 billion, but they brought in capacity in hospitals and mentioned research in health. You would find that much of this has gone to the hospital and not even to the health research. So it is quite limiting. This is, I just...
Mary, if I may, Mary, in time, I wish, could you please summarize? I know we are combining.
Yes, I'm actually finishing. I'm finishing. So this is just to show that the foreigners have the highest percent in funding the Kenyan research. And the research that we clear here is mostly funded by the universities. You can see by those percentages. And with that, I can only say that if the government can actually heed to their pledges, what it means that if we fund our own research, we own the results, we trust the results, and they can easily be shared across sectors and make policies within the government. So it will also increase the, the conspecialization of the findings. It will make us, the government, the uptake of the results will be high. And yet that means it will translate into the products on policies. Thank you.
Thank you, Mary, for that presentation. I think you have, just to summarize, basically, Africa and Kenya, we have underinvested in research. and therefore the output that we get is not aligned to our needs, and is mostly driven by the person who is paying, which is mostly the external funders. And that is really a grim situation that even when we commit, we still progressively not seeing any growth in the budget. And I think we need to listen now to Ethel Makila to facilitate us on how can they advocate for research development, and so how can we target the advocates, how can we reach the research leaders and government so that we entrench the investment of health research and development into laws and policies, because we can see really there's been limited investment and chronic investment despite the commitment. So Ethel, please guide us on how we can actually get these policies and laws into place and make sure that we are funded. Over to you. We'll get the questions and combine after presentation from Makila. Ethel.
Yeah. Thank you, Dr. Langat. And it's really a privilege for me to speak about an issue that is really close to my heart. If there's one thing that I think the COVID-19 pandemic has shown us about our country, is that there's no shortage of scientific leadership, there's no shortage of individuals or institutions that are able to innovate and develop homegrown solutions for our public health. And when I'm speaking about this, I'm really thinking about the young team of innovators at Kenyatta University. They come to mind. They developed a respirator using locally available materials. And not only that, that respirator is designed to take into account our local context of energy sources, whether or not there is electricity available. And that's really an important aspect as to why we really should be looking more and more into homegrown research. And there are other examples. The rapid diagnostic kit that was developed by Kenya Medical Research Institution for the COVID diagnosis to enable more rapid testing and mass testing for the country, and many other examples do exist. So really, while it is great that the pandemic has demonstrated our ability to manage, figuratively speaking, manage a fire, how about now we start focusing on fireproofing our house? And really that is a focus of my talk today. What can we do long term to look at our health and secure our health over the longer term? And I've been asked specifically to speak about the role of advocates and advocacy in prioritizing health research, development, and innovation. So maybe for starters, I'll define whom I see in my perspective are advocates. If we look at advocacy as garnering the public support for a recommendation of something that is of public interest, a cause that is of public interest, then in that case, every single person who is on this call is an advocate. All of us are advocates in our own right, because we are all interested in seeing research and development and innovation speak to our health, get the prominence it deserves. Whether we are from the nonprofit organizations, whether we are from research, we are from community-based organizations, faith-based organizations, we all are advocates, all of us. So really when it comes to prioritizing research, development, health research development and innovations, there are very many aspects, there are very many facets, but I think I will limit myself right now to the aspect of investment. As I mentioned before, we've shown that we can control, we can manage a fire. Now we need to fireproof our health by investing in the longer term. And one of the ways to do this is for us as a country, I'm speaking to the situation of Kenya, and I know that it represents the situation in many other African countries. We need to put our money into research, and not only put money into research, but to ensure that we use it well. So we've agreed that we are advocates, all of us. So to begin with, what can we do? I think the first thing is that we really need to make it clear that putting money into health, research, and development is an investment. It is not an expense, and it should not be looked at as such. The same way you'd put money into stocks, into bonds, into shares, and expect to get something back after some years' time. We should start thinking and communicating as such. Putting money into health research is investing in ourselves, in our health, in our economy, in our country. And Mary rightfully put it that a lot of the resources that we use for research currently are from external sources. And granted, he who pays the piper plays the tune. But we do have our own disease areas, health systems issues that are of priority. And it's time to articulate the need or the importance of putting money into these specific issues that are important to us in economically comprehensible terms. You know, the decision makers that we have, that we are relying on to put these things into law, to develop the policies, to guide the resource allocations, to oversee the implementation of these laws and policies, they understand the language of economics. What is the return on investment? How many deaths have we averted? How many lives have we saved? So I think as civil society organizations, as researchers, as academia, we need to be working together collaboratively to ensure that our advocacy messages really communicate in no uncertain times that putting money into research for health is an investment so that it does get the priority it deserves and it does get the attention it deserves. There are many ways of doing this. You know, as researchers, we can get together and have modeling scenarios of what happens if we put this amount of resources into this disease area. How many lives are we going to save, or what kind of economic gains are we going to save by saving money from what we would have used to treat or to provide long-term care. And also, we could also even help do research that helps to identify alternative innovative funding sources. I mean, there's another lesson that I actually learned from the COVID-19 pandemic situation is that there is money, there are resources available that we need to tap into to support research locally. There are very many sources. And with regards to policies, I might just like to clarify that we do have a starting point. It's not that we do not have the policies that prioritize the health research. The creation of the National Research Fund in itself shows that there is the will. There's that idea that research and development is critical, it's important. And last year alone, 2019, there were two important documents that were launched with regards to health, health research and development. There was the Research for Health Policy Framework and the Research for Health Priorities. Now, these documents are supposed to coordinate the health research activities that are being conducted across institutions, whether it's public or private institutions. And they really lay out what are our priority disease areas, what are our health systems priorities. For example, the priority number 3 is disease outbreak and preparedness. Now, we launched that document last year and COVID has happened to us this year. And my question is really from, we have the policy. So what have we done in the interim between the time of the launching and the acknowledgement that this is an issue to the time we face the issue itself? There's even a provision for how the country is supposed to finance the health research. For example, the National Health Research Committee is mandated, amongst other things, to ensure that there are resources that are mobilized, or even that there is budget allocation from the National Research Fund, the NRF, towards health priorities. As Mary mentioned, the NRF is open for all areas of research and development. So health is competing amongst other priorities. But the National Health Research Committee has a mandate to ensure that really from this pie that the health research does get a level of prioritization. So as advocates, what can we do? I ask again. I think one thing we can do is really acquaint ourselves with these documents thoroughly, acquaint ourselves with the documents, acquaint ourselves with which individuals have been mandated with which tasks of the implementation, with which institutions have been mandated with the implementation of these policies, so that we can see to it that we are able to move from policy to practice, to action on the ground. We really should be thinking about how to walk alongside our policy and decision makers to help keep them accountable. Yes, the laws are in place, but what next? What are the steps next? We can bring to the table our different strengths to identify incremental actions that will in turn translate into the accomplishment of this big goal of seeing health research, development, and innovations really speak to our country's priorities and to our country's development agenda. What else can we do? I'm really thinking about, as advocates, can we develop a sort of a scorecard that can be used to really interrogate the development of the budgets? What is it that informs the allocation of resources to health R&D? Can we contribute to that? Can we help the economists really understand how and why this year more funding should go to this area as opposed to the other area? You know, if we are looking at medical or medical or health researchers, I believe we do have an inkling or an idea, an understanding of what it is that we really need to be prioritizing as we are, you know, as time progresses, what it is that is more important or what it is that will lead to a gain in another area. And so really packaging this in such a way and making the relationships, creating those relationships that will help us speak and have these conversations between us and the policy makers and the decision makers and the budget holders really is critical. Can we become familiar with the budget processes, with the budget analysis, the documents that are relevant to research and innovation at the national and the county level, for instance? And I'll just mention at this juncture that actually, why I'm speaking so passionately about this is because as part of the IAVI team, this is one of the areas that we're looking at. Can we get together more civil society players to understand these documents, have health economists walk us through what are the budget cycles, what are the budget policies, what are the inflection points, whom is it we should be speaking at which point, and how can we really have these relationships that will help us gradually see ourselves really entrench budget and financing and investing in health research and development. And one other thing, can we have, from the researchers' perspectives, can we put together our heads and have measurable indicators which we can match up against which research is funded? So for instance, if the National Research Fund does put money or wants to prioritize an area of research or a health system, do we have measurable indicators that we can then say, yes, you give us this amount, and over this period of time, we are going to see this kind of change, and this is the gain it translates into. And something that we can track over time so that the money comes in, it is utilized well, and we have the outcomes that we anticipated at the end of it. The SMART goals, things that we do for our personal and professional lives, can we really apply that also to our advocacy? I know there's so much that I could really say about making research development and innovations work for our health system and for our health as a country. There are other issues. There's the issue of training and retaining the human resources in research. There's the issue of improving our research infrastructure, protecting intellectual property, having a regulatory environment that is enabling to the research and to translating the research into actual products that get into the market, and also creating of an environment where innovators are able to scale up and to get economic returns, not just for them, but also for us as a country. But I will just end by reminding us all, we are advocates, all of us. And if we feel that research and development is important to the health of our country, then we do have a civic duty to advocate for its prioritization, for the proper resourcing and financing of research, for accountability to ensure that we do get a return on our investment for health research and innovation. And with that, on that note, I'd just like to end and hand it over back to you, Dr. Langat.
Thank you, Ethel, for such a wonderful presentation. Yes, we are all advocates for health research, and we have ably reminded us that the economies and the people making decisions want to see return on investment. So we need to challenge ourselves to demonstrate results that can convince that research in health is an investment and they can see returns. And I think we have also reminded us that we already have the winning templates. We have the framework and we have the priorities for health research. So basically is to make sure that we act on those. So thank you, Ethel, for a very good, wonderful presentation. So we are going into the question and answer session, and we are tracking the questions on the chat. So I'll start with those questions which has come to us from the chat, and they are directed to specific presenter, but I think if you have something to add and the question was not directed to you, feel free to join in. So from Teresia Kinyari, and basically she's looking at all panelists, and she's asking the question, if one has an innovation in health device, can they be funded to develop it by NACOSTI? And I think related to that is, what are the existing opportunities for research development and innovation investment, and how can researchers tap into these opportunities? So that is one, is a set of two questions. I'm also going to combine with the third question, and basically is looking at investing in domestic resources is essential in strengthening research for health in Kenya. How would a sustainable financing model for research for health that involves both public and private sectors look like? And that question is addressed to Onsariko. And the last question, which will be number 4, I'll then, once you answer this, then we go to the other sets of questions, is a question from DSW and is directed to Dr. Onsariko. How can government's commitment to R&D be translated into tangible investment in Kenya? So if you could get those sets of, it's around 4 questions, then we go back to the remaining sets. I don't know, Mary and Ethel, did you get the questions?
Sorry, Dr. Langat, I got the first one. If there is an innovation, we should fund to develop into full product.
Yeah, so I think, Mary, you can answer the first question. Then I then ask again the second question so that we also don't overload you. So I think the first question, yes, you got it right, is a question if there is an innovation on health device, can it be funded by NACOSTI? But related to that also is asking what are the existing opportunities for research development and innovation investment, and how can the researchers tap into it? Over to you, Mary.
Okay, thank you, Dr. Langat. NACOSTI does not fund. NACOSTI had that function until 2015. So when NRF took over, when the Science Act was revised, actually 2 more institutions were established. That is National Research Fund and Kenya National Innovation Agency. So all those 3 institutions, including NACOSTI, we are all resided at the same place here now. And the idea was that when NACOSTI sets research priorities, national research priorities, NRF picks up those research priorities and advertises for researchers to apply for the grant. And any innovations that comes out of those research should be channeled to Kenyan Innovation Agency. So yes, if you have an innovation, you register with Kenya National Innovation Agency, and then they will advise you. Actually, they have been established purposely to handle the innovations in Kenya. So, and those are the ones that can fund if it is viable. They have different stages. Either it will be from a prototype to an incubation, and if it is it can be fully developed into a business plan, then they will help you.
Well, thank you, Mary. I don't know whether Ethel, you have something to add?
No, perhaps I would just mention that the National Research Fund does actually put out calls from time to time for research proposals. And I believe those are by and large, Mary, you could correct me if I'm wrong, they're by and large guided by the national priorities for research that have been identified. So it would also really be great for innovators to also look at what are our priorities, our health priorities as a country, and possibly that would, be a greater contribution towards either success in attracting financing for research. Back to you, Dr. Lambert.
Well, thank you, Ethel. So I think the next question is around investment, domestic resources. So, and is directed to Onsariko. So the question is, investing domestic resources is essential in strengthening research for health in Kenya. How would a sustainable financing model for research for health that involves both public and private sectors look like? So it's a question of how to bring together both the public and the private sector into research. And maybe we can also combine the same with question number 4 from DSW. How can government's commitment to research and development be translated into tangible investment in Kenya? Mary, did you get those questions?
Yes, I do get. It's all about funding and investment. So that is where we have a problem. The national cake seems to be very little for all of us. You can imagine with now the current situation that they can, even, I give an example. What was declared in May as an economic stimulus package of 1.7 billion, which was given to health. And there was a rider that it will help in capacity in hospitals and then research. Just going by that, you would see that very little has gone to research. So it is hard to actually advise on that, but what will mean is if you bring an investment that aligns with the priorities, and most companies will always want to invest where they would have returns. As my colleague says, that if we look at this research as an investment, there is no investment that you don't expect returns. So most of our research, I can tell you there are several products which are not actual products, but prototypes that are within laboratories in research institutions, including even the universities where students are very vibrant, and that is the critical mass we have for innovations. But because it is not aligning to what the industry will want to invest in, it is just left there. So most of these investments come as academic. I want to come up with a new something just because I want to graduate for my master's or for my PhD. But it is going to serve who? So if, because I know now currently we are trying to see how the industries can feed into the academics, because most of this research takes place in academics. So that when the students come up with innovations, they should be innovations that are solving a problem that is existing. And for sure, if you do that, automatically you'll get your investment. And the government to have put the Kenya, that is Kenya National Innovation Agency, it is actually a way of recording and guiding. They may not give you so much, but once you have been highlighted, and it is a platform for marketing also. So it is very hard to get fully funding investments if they are not answering any, they are not solving any problem of anybody. It could be an academic innovation. It could be a scientist innovation, just, for just research, as we say. And that is where the mismatch comes. If our innovations can match with what the industry needs, what the public, as long as the investment is solving a problem, you will not miss an investment into it. Even there will be a lot of companies who would want to put their money there. Like now we have a big gap in pharmaceuticals. We don't have much investment in local pharma. You know, we have rich in herbal medicine, but that sector, very minimal investment is carried there. And much of the research, I can assure you that the active ingredients have been carried elsewhere, and it could be some of the medicines that we are buying.
Thank you, Mary. So I'll have another set of 3 questions. If one of the question is not clear, do let me know so that I clarify. So the first question on that set is, what kind of organization stroke entity will be best placed to attract and manage research for health funding? And the second question in that set is, what mechanism should we put in place to track and report on investment made in research for health to give realistic view of such investment annually? And the third question in that set is, in the next 5 years, how will research for health priorities in Kenya contribute to achievement of universal health coverage and improvement of the quality of services for the citizens? Some of these questions, of course, I know you are not working, maybe you are not actively working in the health sector, so it's okay. We invite you to contribute based on your understanding. So it's open to both Itel and Mary. So Mary, maybe Itel, you can start off and then Mary follows.
There's a question that you asked about what can we do to track. Sorry, would you just go over that question again? I think it was the second question. What can we do to track the investment?
Research.
Yeah, so the question is asking about what mechanism should we put in place to track and report on investment made in research for health to give realistic view of such investment annually. So it's a question of really tracking the resources, whether it's the money that has been put and probably the output in health research, yes.
Yeah, I think that is really speaking to the concept that I raised of whether we should really be thinking about having a scorecard. You know, like at the Africa Union level, there is a scorecard, I think, that was put in place to track investments into health overall, and I think into investments into specific areas of health, the HIV area overall. And this scorecard really has indicators of how much money goes into a particular area or which country or so for us it could translate into which department, which sector is putting in money, or where are we getting resources, or which research area is getting specific resources, and how do those match up against the research priorities that we have set out in our policy document. It calls for a lot of work. It has been a journey to get the document for the research priorities and the research health research framework developed. And in my perspective, that is just really the beginning of the real work. The work is in having this scorecard, having this tracking, and having these conversations, if it is through national conversations, convenings. I like the fact that we as a coalition, the CHReaD coalition, we do have these conversations with individuals from different types of organizations. We interrogate these things together, and we bring together different kinds of minds. Scientists, we bring together, we have innovators in the health area. We have conversations with policymakers. So really, I think this is just the foundational bit. And the real deal is having that scorecard and tracking that scorecard and really taking this thing seriously.
Thank you. Then, Mary?
Yeah, Actually, my colleague has answered the tracking of investment very well. The problem that we have, is it the transparency of this money that is allocated to some of these institutions for research. It is not open to even get data of how much have you been allocated, because this is your mandate to do research. It is not easy. So if that transparency is not there, then you can guess what happens. It may not translate to exactly what is required. So as for policies, because most of the government institutions put in place, like I can say in Nakosi, we have a policy. NRF was established because of that, because of the funding issue, and it was put down that let 2% of the GDP be allocated to NRF so that it can fund research. But do we really reach that target? It is never reached. The Ministry of Health, in their Act 2017, they have put under that research committee, I think they have put an allocation 30% of what is allocated to NRF to go to research. Is it really even applied? So even what NRF gets, it is too little. And remember, it is used for across sectors. So I think it is I don't know whether it's the players or the transparency of following what is rightfully for research, and whether it has done what it's supposed to be. It has been invested into the right priority. It is hard. It is hard to track it. But as she says, advocacy for value for our money. If that value for our money is followed strictly by advocacy, then we may start seeing now some results. But for policies are already in place. If it is the percentage allocation, it is in policy. So that's why now, once we fall short of what the government gives, then the donors come in, and what the donor gives you is what you run with. So it may squarely fall under your priority or not priority. Acosta set the priority in research, health included, but I don't know how many have gone into that priority, because what the NRF has is very little for all of us.
Well, thank you very much. I think we have an opportunity under CHReaD, I think, looking at the work plan from 2021 for the next 3 years. So I think we'll come back to the CHReaD members to look at whether, that scorecard, is it something that we can develop and also really put in opportunities to look at an accountability framework that commits the players to report. I know it's a challenge, but that is why CHReaD is here. We need to make sure that we all agree that this is a common approach and people can report on expenditures. So maybe if I then set, I know there was a question on whether in the next 5 years the research health priorities will contribute to universal health coverage, but maybe just 2 years. I mean, the priorities was informed by the direction of the government to go through for UHC. So what matters is really the investment in those health priorities. Yes, the priorities are there, but if it is not supported by money and really proper investment, then it becomes a challenge to also address issues of universal health coverage and also improvement of quality of services, which is really a critical component of UHC. So the next questions one is addressed to Ethel, and the question is basically, if Kenya was to invest, it says if Kenya's economy will, I think the question is whether Kenya's economy will blossom if 2% commitment in R&D is invested today. So that's the question. If we are to put 2% into research and development, will we see the economy blossoming? And then the second question is, what are some of the key changes that need to be instituted to enable policymakers' demand for research evidence in policy formulation? Of course, government we formulate, as in government we do formulate policies and whatnot. So it's just a question of what changes must we need to put to institute to ensure that the policymakers' demand for evidence for whatever policy that they formulate. And I think the other question had been, it was asked about the kind of organization and entity that can attract and manage research funding. I think we didn't answer that, but maybe Mary, you can just speak to it. I think there are basic requirements in terms of registration and whatnot, but maybe you want to speak to that. So those are the three questions for both Ethel and Mary. And I think the first one was addressed to Ethel, and the question is, will the economy blossom if we actually invest the 2%? Over to you, Ethel.
That is a good question, and we probably do need modeling and projection for that. But if we are to go by the evidence of what has happened in other countries like Germany, which invest heavily in their health and health research, and then we look at the effect on the economy. I mean, a nation's people are really its wealth, the human resource. If we are spending so much on curative measures, if we are spending a lot on dealing with issues that are as a result of health, then that, I feel, is a leakage on the economy. If we can put that towards ensuring that we have good health over a period of time, then I believe we will be now looking at other, we'll be able to look at other issues and put money into other areas. And I think that translates into economic development. I would suggest that we actually do work with economists. So this is why I said we are all advocates. We do need at the table health economists, national economists, and the research fraternity, and we, the civil society organizations, to really draw up. There will be an improvement, but we really need to put it, to crystallize how much of the improvement. I think possibly that is the question. How much development, how much improvement do we expect to see if we put the 2%? I don't think it's a matter of will there be an improvement, but I think it's a matter of how much will that improvement be to the economy.
So thank you, Ethel. Mary, on the question of policy and the evidence.
Okay, I don't know what the participant wants to. Is it evidence to formulate policies, or a policy that has already been formulated? Then we have the 2% allocation to R&D. So is it the evidence that R&D has taken place, or the evidence of the allocation of the money? I didn't get exactly, so I don't know how to answer that.
So the question, Mary, I mean, the basic understanding is that when you are formulating a policy, it should be driven by evidence. So I think it's just a question of what needs to be put in place to make sure that when we develop a policy, it is really driven by evidence. And that means if it's driven by evidence, then you need to invest in research so that you can generate those evidence that can inform policy. Probably you can do that by extension or implied. I hope that clarifies.
I can imply from what we clear research. And I give just a figure between 2017 and 2019. The budget of those research is up to a tune of 2.9 billion. And this is from, I think, PATH research. They indicated how the sectors that are funding that, it is not the government. So for this policy, for the act, the ST&I Act to have been revised, it was because we realized that the research that we were clearing, most of it was being funded. And when it is funded, we are not able to control the results. We are not able to absorb the products. Sometimes the products are not directed to us. Then they revised the policy. To create a national research fund, a fund that is dedicated purely to research. So it was out of evidence that a policy was revised and an act of parliament was enacted to establish NRF. Even Kenya, it's because of so many innovations were being carried and taken away by, foreigners. They come, they like, an example is the M-Pesa innovation anyway. So it's because if it is not supported locally, whoever is supporting that innovation will carry the day. So there was most of these, we don't do a policy without evidence. And for government to enact it into a law, it has gone through all systems until no doubt that required. So even in the health, for them to have revised their act and came up with the 2017 act, why did they have to, they made sure that it's in law that 30% of NRF should go to health research. That is quite a lot. So that the 70% is divided among the rest of the sectors. So there is evidence that money is needed or investment is needed in those given areas, especially now with the health sector.
Well, thank you, Mary and Ethel. And looking at time, we are to close at 6:30. So I know there are one or two questions that will go unanswered because of the time factor, but I want to take this opportunity really to thank everyone. And I don't know whether you have a parting shot, Ethel and Mary, before I make the closing remarks. Mary?
Yeah, thank you, Dr. Langat, and I really appreciate that you made this one happen. It is a platform that I've learned a lot from Ethel. Advocacy. We need the advocacy of science. Science is really, as scientists, we are not vocal, we are not orators. We may not pass our idea. We could be having very good ideas, but we don't know how to advocate. So if we are able to have such forum and invite them to, to advocate these issues, science and R&D, because science is actually what has lifted most of the economies. But how to lure the policymakers, maybe that's where we have a problem. So thank you so much on this platform, and I hope to participate more or even to have such in the future with these institutions that control the research, control the fund, and the absorbers of this fund. Thank you.
Thank you, Mary, and for sure we'll be coming to you for support. Ethel?
Yes, I was just about to mention that I think I hear an open door to NACOSTI. And so we will definitely be taking advantage of that and looking forward to working together. I mean, our health is really our wealth, and we have to work together to ensure that we secure it, that we invest in it, and that we actually keep track of what we are doing, that we are really purposeful about the investment we are making in our research. We have brilliant minds, we have brilliant scientists. Here in our country, we have institutions that are equipped and can even be even more equipped to develop innovations that are going to respond to our needs, that within our context, that respond to our priorities in the way that speaks best to us. So we really need to put our heads together, develop these relationships. I am a partnership broker. I believe you can already see that. Get together our heads and see how best we can have the ideas, put the ideas into actionable items, and then get to the ground and see these actions work for us. Thank you.
Thank you. So thank you all, and really I want to express my gratitude to the speakers for your time and the expertise that you shared with us today. I think it was great to hear your perspective on what is happening, and now we can strengthen our response to COVID through research, development, and innovation. And for those who attended, thank you for your engagement and thoughtful questions. We know that we couldn't get to answer all the questions, but we hope we will continue to follow the series of these webinars and we hear more from the panelists or the experts that we are lining them up for you. And really from the great members from PATH and AMREF, we want to really thank you once again, and to have a nice evening, and see you next time.
Thank you.
Thank you.